There and welcome back. Today's topic is sleep. Sleep is a very difficult thing to get for some people, especially if you're raising an infant or working two jobs. There is not a whole lot I can do to help you get better sleep. But if your sleep is being interrupted by things like sleep apnea or elevated neurotransmitter levels or poor sleep hygiene, I can help with that. So the first place to start is how good is your sleep? You'll see at the top of today's program that there's an Epworth Sleepiness Scale. I like the name. If you go through, you're going to see that it's on a scale of 0 to 3, and you're going to go through these questions and rate yourself based on how sleepy you are and how much your poor sleep is affecting your life, especially the next day. If you scroll down here in the program, you're going to see where you can take your tallied up numbers and see how you do. If you have a score of 11 or higher, you're having excessive daytime sleepiness. We need to start exploring why and what we can do to help. Is it because you are going through menopause and you're having hot flashes? Well, we can help with that. Is it because you can't shut down? You're having a hard time, turning your switch off? We can help with that. Is it because you are working out so hard that you have excessive levels of epinephrine and norepinephrine circulating in your bloodstream, and so your body is just having a hard time flipping that switch? Maybe you are taking sleep aids like Ambien, and that's interfering with your REM sleep. We need to find the cause. If your number is 11 or greater, then that's reason to be concerned. There are so many studies that show poor health and poor mental health specifically is very significant, is very highly related to the quality of our sleep. Sleep trackers are important because they not only tell us things like how long we're sleeping, but how good the quality of sleep is. People that drink a lot of alcohol and pass out at night or take things like Ambien or sleep aids, they might fall asleep, but they're not getting the deep REM sleep that really is associated with the positive benefits that we get from being asleep. We also have higher levels of hormones when we are sleeping. And if we're not going into REM sleep, then your testosterone spike, your growth hormone spikes, they're going to be lower than they should be. And so if you want optimal hormone function and optimal functioning the next day, really making sure that we get this number down below 11 is going to be very important. And sleep trackers can help a lot with that. A couple of tips that you can do for better sleep. If you are raising an infant or if you're working two jobs, then there's very little that I can do to help you get better sleep at this point. That's more of a situational thing that's going to have to either fall by the wayside or get resolved in order for you to get past this hurdle in your life. But if there are things that you are doing that are foiling your attempts to get good sleep, then there's things that we can work on. Eating meals at the same time each day and finishing your eating 3 hours before you go to sleep and trying to go to sleep on the same and trying to get sleep on the same schedule each night has been shown to be very effective in increasing the amount of deep sleep that you get. And so going to bed without a full belly and going to bed at the same time every night is going to help a lot. Physical activity is going to get that adrenaline out during the day and fatigue you to where you're adequately tired at night. The added bonus is you're going to get better hormone function from that physical activity when you're sleeping because you're going to get deeper sleep those nights. You want to create a positive sleep environment. If it needs to be cold, make it cold. If you need a fluffy weighted blanket in order to sleep, do that. If you need white noise or earplugs or whatever it takes to make your environment comfortable to go to sleep, foster a comfortable environment. You spend a lot of time in your bed. You should be comfortable there. As I said above, avoid alcohol and sleep aids. A lot of those things might make you fall asleep, but it's not good sleep. You're not getting good quality sleep. Better to focus on the underlying reason why your body is needing those aids to begin with. Another topic that I did not put on this tip for better sleep and more energy is to get evaluated for sleep apnea. In Club Optimize, we evaluate all of our patients for possibility of sleep apnea. Sleep apnea is when you're not breathing as well as you should when you're sleeping. If you're not breathing, you're not getting oxygen in. Your body needs oxygen in order to perform a lot of its functions, including all the things your hormones do for you overnight. And so people that have sleep apnea tend to have lower thyroid. People that have sleep apnea tend to have lower growth hormone levels and lower testosterone levels. They also tend to be heavier and more obese and have a poorer metabolism. Improving these things will help a lot of those metrics fall into line. There are a couple of supplements that I love for sleep. We know melatonin. I think most people know melatonin, and it is a wonderful way to get some good sleep. But there's also L-theanine. L-theanine is an amino acid. It can be found in green tea, but it's also available in supplement form. You can click here on this link. It will bring you into my Fullscript dispensary, where I not only have a full sleep protocol, but I also have these individual supplements listed so you can see my favorite brands of them. Magnesium is not only good for sleep, but it also will help improve muscle aches. So if you're having some muscle soreness from your exercise day and you also want to produce some relaxation and stress reduction, lowering the activity of your brain waves before you go to bed, magnesium is very helpful for that. It can be taken in supplement form, but you can also take a magnesium bath if you use Epsom salts. Magnesium is absorbed very readily through the skin, even more so than through the mouth. And here's good old melatonin. One problem that I found with melatonin is that typically it's available in a wide range of doses. I like to start people off at about 0.5 milligram of melatonin, and I've seen supplements out there that are as high as 6 milligrams per tablet. If you're just starting melatonin and you take that off the shelf, make sure you're looking at the dose. I wouldn't take anything higher than 1 milligram to start. Sometimes it can be counterproductive, or you can be excessively sleepy in the morning if the dose is too high. Here's today's tasks. Make sure you're not drinking caffeine at least 3 hours before bed. That seems like a no-brainer, but a lot of people get that afternoon coffee for their little energy boost, and then they get in bed and they just can't fall asleep. Don't eat anything 1 hour before going to bed. I was being generous when I wrote that. I think 3 hours is not only better for sleep, but also will help give you much more valuable gains for your metabolism and for your glucose management and avoiding diabetes. Put down your phone at least 30 minutes before bed. That's a hard one. I know that a lot of people that have very stressful jobs that need to be available a lot for their work or for their kids, it's impossible to get off of their devices. But if you can try to mentally disconnect 30 minutes before bed, a good way of doing that is to make that your meditation time. And so here is a nice video that talks about meditation before sleep. I hope you have found these tips very helpful and you can implement some of these to help correct some of your sleep issues. A lot of us, unfortunately, will find that our sleep issues are related to other things, hormonally related or related to our metabolism or our glucose management, and we're going to discuss those topics later on in further modules. Thank you again. I look forward to seeing you again tomorrow.